it's about a week or 10 days. Now, initially they thought it was about 3 to 4 days, but it's a week or 10 days. So, and, good. And
So
Jeff,
it's
you've been
not
doing
like
it too,
surface
right?
treatment. I mean, that's a very long recovery.
Yes.
And do they have erythema afterwards, like you said?
Well, it's interesting, they have more prolonged erythema than they do with laser coring, but with this type of laser coring. And, but in the fifths, ones, and twos, they've healed pretty well. But in the threes and above, so that was in 2021 and 2022. You know, the interesting thing about this laser, it's a 2910 fiber laser coring, and it's pretty a pretty fascinating technology. And it was cleared for wrinkles and skin resurfacing. And so basically, instead of the mechanical microcoring, it's laser microcoring. And it's a very interesting single pass technology where you basically, it delivers ablation, coagulation, micropulses in the same area, in the same channel, the same pass. And that's why you get less collateral damage versus with the YAG and especially the CO2. And I think that's the rationale where at least we're seeing a lot less discomfort. Certainly, I mean, we're big fans of the Cyton, we've used it for years, but I'll tell you, the recovery is about half that, and the discomfort is probably 50% or less than that. So it's been pretty dramatic. So it's that kind of coordinated energy that's delivered in multiple levels, and it's very, very rapid, and it also aids in wound healing, and they've shown that it reduces collagenesis as well. So, and the other thing is that it's actually got a small entry point, and then it actually at 170 microns, and so as you go deeper, you actually get less collateral injury, and that actually helps promote healing. So, and then this just shows how it's really a very useful device, no disposables, and this is for laser microcoring. And this is David doing it in the neck, and these are all done with topical and with blocks. It's less discomfort than the Eloquent. So these are just some results from their clinical studies. This is again laser coring, 4 months, 1 treatment. One treatment. It's really been shown to be pretty aggressively effective in patients with acne scarring. And the post-op care is actually quite simple. I find it to be far less than it has been with the Erbium with the Cyton. It's just a copper-based cleanser and rinse, and then we actually put on plated, which is an exosome-based therapy that really helps with recovery and tissue repair. And that's really all we use for the first 3 to 5 days. So how do they compare? Well, you know, they're both microcoring. One's a cold fiber laser, one is a mechanical one. And I think the concerns are for mechanical, I think it probably works better if you have deeper rhytids, and thermal laser ones probably not significant rhytids, but the biggest change has been the downtime. At least, you know, the redness seems to dissipate far more rapidly. It's almost counterintuitive with the thermal laser, because I think of the technology of how it's got less collateral injury as it goes deep and bores deep into the tissue. So I think to me that's been the biggest surprise, because whenever I've done at least other types of lasers, the recovery has been, you know, probably double this.
How many sessions are necessary?
Well, they always tell you, you know, you wait 2 to 3 months and do 2 sessions. I think most of the time it's 1 or 2 sessions spaced a couple, 3 months apart.
And what's the patient satisfaction?
Pretty high for, actually it's pretty high for both, but we've just had some issues, and I'm just telling you what, you know, my nurse practitioner does a lot of these, is been the pigmentation issues with the fifths, 3s and above. And then with the coring, it's really been minimal, and it's been pretty aggressive. So I think it's good for mild to moderate, deep wrinkles for the mechanical, and then for fine to moderate for the UltraClear. And I think the greatest thing, and this just shows, this is from their FDA trial, just shows how actually at day 2 to 4, it's pretty dramatically changed. And this is pretty consistent from what we've seen too. The healing progression is fairly rapid because I think there's a lot less collateral injury. And the great thing about this laser is that it's really, it can do multiple things. You know, you can target the stratum corneum, you can do the epidermis, you can do like a micro peel, then you can do a deep collagen, then you can do a, because there's a clear, UltraClear, and then you, when I do it in the operating room, I usually use the UltraClear because I'll do the Ultra, which is deep, and then the Clear, which is superficial. And so it's really pretty easy to use, and like I said, the recovery is amazing. So I think a lot of it has to do with the small spot and the increased number of microchannels with less collateral injury compared to the CO2 and the erbium. It's a really fascinating technology. So just something that I think should be considered in your armamentarium when you're looking at in-office correction of both fine rhytids but also skin tightening. And both of them actually work very, very well. I mean, we've actually just had a lot more experience with the ElitaCore, but I think my nurse practitioner has done close to 100 with the laser coring, and he's really been very impressed. I've done probably a half dozen or so with facelifts, and the recovery is less than half than with the Cyton. And I don't know if that's been your experience, Jeff, but it's pretty impressive. And the results have been really quite good. So, but I think just like with anything else, you have to see what the long-term results are. And the minimal, the downtime, like I said, is minimal, so.
How does that compare to radio frequency, like in mode?
You know, I think, you mean compared to Morpheus?
Yes.
I think the recovery is probably a little more than with Morpheus.
The efficacy.
Yeah, but I think it's a little more powerful than Morpheus. For around the lip and around the neck area. And so there, obviously, anytime when you have a little more recovery, but it does go deeper. And also there's, I think, less discomfort, because Morpheus, especially if you're going deep, is not comfortable.
Have you used it in your post-lift patients that have a little skin laxity, sun damage? Have you found it useful there?
Yeah, I mean, I've used Morpheus obviously a lot more for that, but we've used it on some that have had some laxity in the submental area. Yeah, and it's really been, I think it's been very well accepted by the patients just because of the much more rapid recovery. Because with ElitaCore, you know, they initially said it was 3 or 4 days, and it's really a week or so, and it's probably half that with the UltraClear. So it's just something, they actually are here to, if you want to go by and take a look, it's pretty interesting. And I know, Jeff, you've done some research with them, and what's been your experience?
Thanks. Yeah, I've had some experience with both devices. You know, I think the challenge with ElitaCore is that they took the theoretical reduction in surface area and said that's what you're going to get. If you treat one time, you're going to get a 9% reduction in surface area. And that's not what happens, right? We all know a circular wound fills first with fluid and exudate, and then contracts from the perimeter. And so,
well, they also had trouble with their device initially because it wasn't sucking out.
It wasn't sucking
but
out
it's,
the
it's
cores.
better now, but it didn't suck out.
Right, but I don't think that I don't think you see percentage reduction in surface area that is on the screen. And so we've experimented with for fat type dressings, just to see if you can get a circle to collapse down for 48 hours, and have not had tons of success. And I'm not sure tons of patients are going to want to have that on their face for a few days, but I think that's the challenge that we've had with ElitaCore. I think the 2910 is interesting. You know, they call it a cold laser, which doesn't really make a lot of sense to me. It is an erbium laser, but
Yeah.
I think you're absolutely right. The recovery is significantly less, and they have less hyperemia than what we see with, 2940. I don't, like in my hands, and I think you highlighted nicely the 3 different depths that you can create with a single pass, which is really nice. I've tried to push the envelope and get deeper dermal rhytids to be improved with that device, and I've not been successful consistently. But like
Does that increase your recovery when you're done?
yeah, I think so. And I think the other thing with their deep laser coring is you can have a speckle appearance to the skin for 4 to 6 weeks in some patients. So it's just something that you learn the hard way. However, I do think it serves a role. Like prior to this device, I did not have a good intermediate or intermediate plus treatment in the practice. It was, IPL, simple stuff, halo, and on the other end of the spectrum, it was erbium. And this, I think, there's a role for it.
Good.
Yeah.
And also, I mean, I haven't treated 4s and 5s, but my nurse, David has, and I'm amazed, because I would never treat a 4 and a 5 with sights on. But it's been
Very, and as you said,
amazing.
very well tolerated with the topical anesthetic. The deep coring, you probably would benefit from blocks, but it's only 1 or 2% of the surface area. So if you're just gonna treat a small area, they'll grin and bear to get through it, and then they'll be fine. So I think that's another really nice benefit to it. And we love flexible parameters, all the different parameters that you can choose for that device.
Right.
And you even have the opportunity to use it as a full ablative device. It's a little smaller spot size than what we see with other ones, but I think there's a lot of flexibility there.
Right, and you can even do I mean, it's really a micro peel. It's a fantastic device.
How have you treated the post-inflammatory pigmentation?
Well, you really have to do with a combination of hydroquinone, retinol, and vitamin C, so an antioxidant, a retinol to turn over the skin, and then kojic acid or hydroquinone. It's a combination, and you have to, if you recognize it, it's darker. It's post-inflammatory inflammation. It's either erythema or hyperpigmentation. If it's dark, you need to use Triluma, or compounded, and you got to treat it early and often. And then if it's hyperemia, then you can just treat it with something completely simple.
Any major questions?
How does it compare with like a fractionated laser?
The what?
How does it compare with like a fractionated laser?
I don't have a lot of experience with the fractionated lasers.
It is a fractionated laser.
Yeah,
So-
but I think it's just it's a smaller penetration than a fracture. It's a smaller core. So it's an interesting technology, and I mean, time will tell. It's actually been used now for about 3 years, especially in the dermatologic literature. And actually, Mary Lupo has used it for like 2.5 years.
How long have you used it?
Well, clinically 6 or 8 months, yeah.
Well, thank you, Bob. That was a great lecture.